Hello, my name is Blake Bourque. I am hosting a new podcast called The Business of Medicine, where we're going to unpack all the aspects that go into you providing excellent patient care while being an amazing human being who works out in the morning, who understands anti-aging and longevity, who is an amazing parent and a spouse, who is able to go to church and love their Lord, and also keep the money that they are getting from payers in Medicare, maximizing that as well, because all those things flow into your happiness, your wellness, and your ability to be able to actually serve the patients that need it the most, right? What makes me qualified to even talk about this? Well, first off, basically a professional patient. My wife and I have had an extremely complicated fertility journey that led to her having 13 abdominal surgeries. I've had back surgery. I've had college football for the Raging Cajuns back there. So as a former athlete, I broke my neck, burst my spleen, broken bones all over the place, car accidents, you name it. I dislocated my ankle, broke my tibia. We've had a lot of encounters with different types of, and that was actually kind of before I became a banker and a private banker, where I was hired to bank doctors. So I specifically learned the business of medicine from JP Morgan Chase and from Iberia Bank. So I was able to get into some hospital financing deals, representing and underwriting the bank, rehab facilities, physician-owned laboratories, in rooms with trust advisors and investment advisors that were talking to, hundreds of different providers on their particular cases, and understood their home equities and credit cards and checking accounts and treasury management and like all the things finance related. And that was before I got into owning my own toxicology laboratory, infectious disease labs, blood labs, pathology labs, oncology, like all the ologies inside of the diagnostic lab space, and actually billing Medicare and all the payers and fighting the in-network contract wars and going through the audits and trying to survive sideways audits and recoupments, right? And then that was before COVID, when we saw what happened before COVID and after COVID with the world. And then before we started really servicing home health agencies and helping them streamline their processes and getting into wound care and helping some of the most chronically ill patients like save their limbs and their life. So it has been a very dynamic career that I've held, most of the time in number one CEO or number two type sales officer roles. When I think about the problem with the problem with the business of medicine, it really is rooted in providers, mid-level, doctor, specialist, DO, MD, doesn't matter. The lack of business acumen that they provide you in medical school, because there's like none. You probably learn as much finance as in medical school. Maybe not. Maybe there's none. But when I think about the problem, I've seen it and how it actually cascades down into their personal life, into your personal life. I've seen how it actually cascades down into your children's lives. You being stressed out because of an audit, you being exhausted because you're picking up all these problems that sometimes you can't solve, patients that you were connected with that maybe passed away or you can't cure, or they're really sick. Like, you put up a wall a lot of times on that and you compartmentalize it. So that way you can actually go home with a smile on your face to your family. A lot of people don't understand how hard that is. Having lost patients that we were serving with providers, it's a difficult thing to be able to just all of a sudden turn it back, and show up, as the positive mom role model or the positive dad role model. But that's what's required. We see a lot of times providers that just completely lose their health. And I've been that way. When I got into the lab business, I went from a college football player that had a body like Adonis to 265-pound overweight, 25-30% body fat, borderline, if not full-blown alcoholic, who is making a really good living, making good money. But I let my health it basically, the pendulum was the more money I made, the more I worked, the less I worked out, the more I ate, the more I drank, the less my marriage mattered to me. Like it's a very dangerous game that some of us will play with our health and our wealth. And what are we sacrificing to actually get it? And so, when you have this purpose driven lifestyle that we have all chosen, one of the things I've done, and not at a mastery level, man, because it's a work in progress. You think you got it today, you got it today. Tomorrow's a different day. But showing up with a clear mind, working out in the morning, being completely sober, and having a mission and a vision to serve God, and through these patients and through this podcast, sharing information with you, is because we've made so many mistakes. Like when I say we, the team that's with me right now has been with me for a very long time. And man, I just led them to a bunch of mistakes, and we've overcome a lot of them. We've asked a lot of questions. We've paid for a ton of legal advice. I personally have spent hundreds of thousands of dollars, if not millions of dollars, on lawsuits and legal advice in businesses that we've actually set up, or being a plaintiff and the defendant. Like it's been a road. Yeah, millions for sure. Thinking about it right now. So not a lot of podcast hosts that are going to talk to you about the business of medicine have had to actually like stare down a $4 million Medicare audit and know that it was all on the line, right? There's not a lot of guys that have been there in COVID whenever it was like I was in an infectious disease lab during COVID. So, I have a different worldview of COVID than what the media says and what all the bots on Facebook say, and what a lot of, like, I know what was going on. You know what was going on. We saw it with our own eyes. We know that the mask didn't work, but we also know that there were people who were dying from it, and that were on ventilators. And so that was real. And it changed healthcare forever, man. There's a sedimentary rock layer there that I witnessed and I saw. So like, why am I the right guy to talk about these things? Is because I've been here for the last 20 years. I've been here for 20 years inside of the business of medicine, as a banker, as a diagnostic lab owner, as an infectious disease owner, as an ancillary service provider, and then now as a wound care provider, and as a guy who's trying to put together a clinically integrated network so that way we can better serve patients in rural areas. But also, man, like if we don't band together, we're going to have problems with payer contracts and less. So like, how do we get ahead of this value-based care initiative is what we're working on now. And so that's why I'm the right guy to be having this conversation on this podcast. And this is why I hope you listen to it and you enjoy it. But my prayer for this podcast is that there's things that we say and there's experts that we bring on that are going to shine a light in a dark area, in a place that you need to look at, and a place that's within your capability to be able to fix, that'll improve the patient care that you provide and the employee care and the family care that you provide to those people that love you and that support you. And so we hope you like it. We hope you share it. We hope you subscribe to it. Most importantly, man, we just hope you listen.